Hello, my name is Elsa Vieira de Sousa. I am a rheumatologist working at Hospital de Santa Maria and a researcher at João Eurico Fonseca Lab from Instituto de Medicina Molecular in Lisbon. During my PhD, I aim to contribute to the knowledge of psoriatic arthritis, a chronic inflammatory rheumatic disease that affects joints, tendons, ligaments, and the bone structure, but also the skin, as it is commonly associated with psoriasis. In particular, we were interested in looking at the effect of tumor necrosis factor inhibitors, which are biotechnological therapies that block tumor necrosis factor, a central inflammatory molecule in the pathogenesis of psoriatic arthritis. We started by performing a literature review on psoriatic arthritis treatments that unveiled relevant clinical and basic research questions that were fostered within this thesis. We understood by then that the Portuguese rheumatologists regarded tumor necrosis factor inhibitors as the first-line biotechnological option for all psoriatic arthritis manifestations, and our review led to the development of recommendations that are used to guide treatment decisions. To identify predictors of success of tumor necrosis factor inhibitors, aiming at selecting those patients who can mostly benefit from these treatments, we analyzed real-world data from Reuma.pt, a large database of Portuguese rheumatic patients, and identified several factors that can decrease the success of these therapies, namely female gender and obesity. We then embraced the challenge of developing a national clinical trial having IMM as promoter. This trial engaged several rheumatology departments in Portugal and more than 100 investigators, and it demonstrated for the first time that the combination of a tumor necrosis factor inhibitor with a conventional therapy is much better than a conventional therapy for improving dactylitis, which is a poor prognostic manifestation in psoriatic arthritis patients. Finally, we used the mice strain that mimics some of psoriatic arthritis features that allow us to study new bone formation in the spine of these mice, and we showed that the inhibition of tumor necrosis factor signaling reduces not only inflammation but also new bone formation. In this thesis, we applied a truly translational approach to improve the knowledge in the field of psoriatic arthritis and provide better care to patients. We used a broad methodological strategy that included a literature review, a longitudinal cohort study, a randomized double-blind placebo-controlled trial, and an in vivo experimental setting. And this emphasizes the relevance of a high plasticity of research abilities for achieving reliable results. Most of all, it reflects the potential of the Centro Académico de Medicina de Lisboa that integrates the Instituto de Medicina Molecular, the Hospital de Santa Maria, and the Faculdade de Medicina da Universidade de Lisboa as a remarkable catalyzing environment for PhD students, allowing for the integration of clinical and laboratory work in a very proficuous way. Thank you for being curious.